Oh, uncle, aunties. All right, Dr. Lim. So now maybe we can address some myths and you could debunk them as well, or let us know if it's a fact.
Debunk.
About TCM. Okay, so let's get started. Myth or fact number one. The treatments in TCM use 100% natural ingredients only.
Yes and no. Yes, the TCM site from ancient time, they only have the natural source. Okay. But nowadays, the modern TCM, whereby I've shared in the earlier conversation, whereby they are more and more scientifically backed and refined ingredients being integrated or incorporated into our TCM practice.
I see.
The one that I shared with the Japan technology.
Yeah.
So it's still from a natural product or ingredients, but it's already converted into a modern form of delivery.
Okay.
So you can see the evolution of the TCMs, not only in terms of the diagnostic machine, the AI incorporated, also in the products. So that's natural, yes and no, the answer.
Okay, so no, nothing artificial in that sense, but processed.
Yep.
Okay, all right. Moving on to myth or fact number three. As the ingredients are natural, TCM treatments are appropriate for everyone.
Something natural, it doesn't mean that it's safe for all.
Okay.
This is very important. Okay. Do you know some of the cancer medications or chemo is actually derived from herbs?
Oh.
Okay.
No, we always think it's all like artificial,
all the chemical. Yeah. It's actually we extract and then the active ingredients from one of the herbs, and then we use it. And Taxol groups is a commonly used chemo agents in ovarian cancer, in breast cancer, and even lung cancer.
I see.
Okay, it's actually from herbs. So what I'm trying to emphasize is that not all natural products itself is actually safe. So it's very important to get consultation from a registered and qualified TCM practitioners before you start to consume any herbs. There is a saying in Chinese, when it's a medications, there's always 3 points of toxin, which means that anything when you claim it's a medications, there's always a toxic side of it. No medications is without any side effects.
I see.
Okay. So when you need to use a medication, remember, always consult your healthcare professional.
Okay, thank you, doctor. So that's not, self-medicate even when it comes to traditional medicine. Okay, moving on to the next one. Myth or fact? Is TCM only for chronic conditions? Just a summary.
Just summary. I think I shared it earlier on. It's not only for the chronic conditions in what you think of, but from acute cases, you have common flu, you have headaches, you have acute pains, you have any form of discomfort that you feel that you might want to seek the consultation from a TCM, go ahead. Because they have different methodologies that will be able to help sometimes. But if we are not able to, I always remind my staff, if you are not able to, then we always refer. And that should be the way we move forwards. Not restricting yourself only to one modality. Or always claim that, wow, you are the Superman, that you will treat all. No. But in reality, there are some things which is not fall under our strength. For example, I always tell when I'm doing public educations or even training for the TCM practitioners, I'm telling them, if someone's coming here with a trauma, bleeding, don't tell me you are going to use the acupuncture here and there and then stop the bleeding. No way, okay? So the fastest way, send to the emergency department and get it sutured and then start blood transfusion and save the patient. So there's strength of both systems.
Okay.
So no one fits for all.
Okay, so should respect all systems, right, doctor? Okay, moving on to the next one then. Myth or fact, as TCM treatment is natural, it takes very long to work.
That's also another myth or misconceptions. Like what I shared earlier on, the patients who enter into my center, actually 1 hour later, he can actually walk straight up all the way outside the center. So the TCM can actually give an immediate relief, especially for certain type of condition.
Okay.
Especially myself, if I have ankle sprain, last time a very good example, when I was medical student, I play badminton a lot, have ankle sprain. Then what happened? I go to a GP and they just wrap it up.
Yeah.
It's still pain. Okay, then I go to TCM orthopedics. Just by doing a few manipulation, then I can walk without pain.
Oh.
So you can see there are some things inside the TCM which is for our modern medical doctors, we're actually not fully aware of it. So I always encourage and I serve as a bridge between both sides. So that you better understand more about what TCM can do, and TCM also understand more of what modern medicine actually have come with nowadays. So that's very important. So end of the day, there's no blind spot between both sides of the practitioners that can serve our people better.
Okay. Thank you, doctor. Okay, myth or fact, TCM can complement Western medicine?
Definitely yes, because in our Ministry of Health, the policy itself, we already put it there. So it should assist together with the Western medicine, at the same time complement. So the very good example will be what I've been practiced nowadays. The patients receiving the chemo, radio, immuno-targeted therapy, whatever they're suffering, then the side effects, the herbal medicines or the TCM sites or the acupuncture, we can help and try to alleviate all these signs and symptoms. At the same time, we help the patients to complete the conventional treatment. Okay, because in the conventional treatment, what we don't want is we don't want any delay. Most of the time, side effects too strong. Patients have to delay it, not able to complete it halfway, and then it defeats the whole purpose of having such a what I call aggressive treatment. So then herbs at the back, we serve to support you so that you're able to complete it.
I see.
So we can complement.
Complementary. All right. Okay. Myth or fact? TCM practices has no scientific proof.
You can see, you just search online nowadays, all the audience there. It's very simple that you just key in whether there's any scientific proof. There's a lot. Growing more and more. More and more, especially in acupuncture. Acupuncture, why? Because Western medical doctors, they're very amazed why the small needles that can achieve so many things. So they have put in a lot of efforts into trying to see, how it's going to help. So there have been conducted a lot of studies, whether it's in States or Europe, and then plenty of papers has been coming out. There's positive result. There's also negative result. But it's good. But it's good. Yeah. Why? Because you have a clear picture. What's the strength of the acupuncture able to help in what sort of illnesses or symptoms or signs they're able to help. So it gives us as have a better understanding of acupuncture and how it works, the mechanism of action. So I would say a lot. It's just that whether you have the time and really look into it. Okay. Because papers, still papers. You need to know how to critically appraise it. Okay, it's very important, and these need trainings. Not all papers are always. There are patients nowadays are so well educated, and then they even come up with a whole stack of papers in front of you, asking you, whether I can use this intervention, whether I can use that intervention. There are papers there, there are papers there. But some of that is preclinicals. Preclinical simply means that it's a lab work. It hasn't been applied on the human beings. So from the lab to the clinicals, how long it's going to take and how much you have to invest. So you cannot just simply because there's a lab papers and then you're telling this able to achieve what. Okay. So I always remind all the publics, remember what you have enhanced with the papers, you have to appraise it and know what you're reading. Rather than simply everything, just believe inside. Okay, all right. So that means there are scientific evidence. But at the same time, please, consult a doctor because the doctor will be best to understand this scientific evidence as well. Okay, and papers. Okay, moving on.
Okay, myth or fact, Doctor? TCM practices are linked to religions.
Oh, okay. Yes, in the sense, not religions, because TCM itself is actually originated from Chinese culture. Okay, it's part and parcel of the culture. But the universal concept or the core philosophy of achieving balance using different methodology is actually far beyond religion. Okay, so don't link it like, oh, this is Buddhism, Taoism, or things like that. But the concept itself is actually far beyond it. So I would rather say it's not really linked to religion, but yeah, it's originated from the Chinese culture.
Okay, originated from Chinese culture, and at the end of the day, it's medicine.
Yep,
it's
medicine is not religion related.
Correct. Okay. Last one, Doctor. Myth or fact? All TCM practitioners are equally qualified.
Not really. Okay. Because different, even GP in real life, they may have a different strength. Why? Different religions, the type of patients you encounter will be different, and this will give you a different types of experience. For example, some regions whereby they are full of diabetes patients. Wow, you will be the expert in how to deal with all the insulin injections in controlling the glucose level. Okay, as compared to another site whereby they hardly have any diabetes patient. Most of the time they have hypertension patient, flu type of patients. So they will have more experience. So even in GP, in our Western medicines, there are different doctors with different experience and training in terms of their master and their PhD or their subspecialty training.
True.
So same applies to TCM. Okay, that's why some of the, although we call it a GP TCM practitioners, they may be well versed in gynae-related type of illnesses. Because before this, they have been seeing so many gynae cases in their hands, even before the so-called 5 years degree program has been offered in the market. So they are experienced in that.
Okay.
But bear in mind, the important thing is those who is what I call a qualified and well-trained TCM practitioner, they are there to come out and get themselves registered. This is very important.
Okay, so that's the key.
Those bogus one, they're worried about the examination. Because for TCM practitioners in Malaysia, besides those 5 years trained graduates, those who has been practicing in Malaysia, you need to go through a training program.
Oh, I see.
Yes.
Okay.
And then there's exams some more.
Oh, okay. And this is by the MOH themselves.
Yes. So that's those got problems one. Actually, they will try to avoid these kind of things. They're worried about traceability. They don't want you to track them.
I see.
So once you get yourself registered, your name is found under the registry. Then everything you've done wrong, you are indemnable for such thing. So that's about it.
Okay, so we have to look out for the cert.
Yes.
Okay, all right. Thank you, Doctor. And just one last part. Your parting advice to our viewers out there. Any parting advice?
There will be more and more growing demands and interest into TCM's treatments. I think that's a very good trend. Because we start to aware that our body is not only from the angle of modern medicines. I always share with my practitioners or students, science is only one way of looking into matters. Science is not everything.
Okay.
What we know now, by this moment of time, it doesn't represent what will happen for another 100 years or 200 years later. What holds today may change.
True.
So when we look into illnesses or health, there should be 2, 3, or even 4 more than that different angles on how we look into life. So it's good that we start to aware, to have more angles to looking into health. But bear in mind, always look for those credible, reliable products instead of getting some of the advice from the street Okay, that's about it.
Or uncle, aunties. Okay, thank you so much for your time, Dr. Lim. I had a great time with you and learning a lot about TCM as well.
I'm learning a lot from Edeline as well.
All right, thank you everybody, and that's today's episode of Sembang Tak Kosong.